How to stop baby hiccups. Your baby is hiccuping. This is very common, and it may bother you more than it bothers your baby. Most babies will grow out of chronic hiccups as their digestive systems develop, and most hiccup attacks will go away on their own. However, hiccups may cause your baby discomfort, they may disrupt feeding sessions, and they may indicate acid reflux if they are accompanied by vomiting and stomach pain. Read on and learn how to stop baby hiccups. Method 1. Stopping hiccups quickly. 1. Sit your baby upright. Sitting your baby upright may help relieve the pressure in her diaphragm. The gas that is distending her stomach will rise to the surface, allowing her to burp and release the pressure. 2. Nurse your baby. Hiccups are spasms of the diaphragm. Breastfeeding your baby may help her diaphragm relax, stopping hiccup attacks in their tracks. Refer to this method on preventing hiccups while feeding. Be sure to feed your baby slowly so that she does not suckle too much milk too quickly. Pause to burp her at intervals, and give her plenty of time to digest. 3. Burp your baby. Burping, especially between feedings, brings trapped air to the surface of your baby's stomach. This can help relieve the gas buildup that could lead to hiccups. 4. Give your baby a pacifier. Sucking on a pacifier can help regulate your baby's breathing and relax the diaphragm. 5. Give your baby water if she is older than 6 months. Fill a glass of water about halfway full, and pull a tissue tied across the rim to regulate the flow. Gently give your baby a few small sips of water. Be sparing. Babies do not need to drink water until they are 6 months old. Up till that point, they get all of the hydration that they need from breast milk or formula. Giving a baby younger than 6 months too much water can interfere with her bodice's ability to absorb the nutrients in breast milk, as well as curbing her appetite by making her feel full. Method 2. Preventing hiccups while feeding. 1. Consider keeping a hiccup trigger log. When your baby gets into a hiccuping fit, write down the date, the time, and the circumstances. Which settings and feeding practices seem to trigger your baby's hiccups? If your baby hiccups during and directly after breast or bottle feeding, she may be eating too quickly or gulping excess air. Review the following steps to prevent your baby from hiccuping while feeding. If your baby hiccups at night, painfully, in association with painful vomiting, this may be a sign of acid reflux disease. Refer to Step 4 to learn about acid reflux. 2. Feed your baby twice as often, but half as much at each feeding. If the stomach expands too quickly or becomes overfull, it can trigger the diaphragm to spasm into a hiccuping fit. Thus, babies can begin to hiccup when they suckle too much milk too quickly. Feeding your baby less milk at shorter intervals will ensure that she does not fill up too quickly. 3. Burp your baby. Stop to burp your baby midway through a feeding, once she has suckled 2 to 3 ounces, 60-90 ml. This will break up the feeding and give your baby time to digest. If you are breastfeeding, pause to burp your baby as you switch from one breast to another. This may aid the digestion process. Wait a few minutes before resuming the feeding in order to give your baby time to digest. If you are bottle feeding, pause halfway through the bottle to burp your baby. Finish off the feeding a few minutes later once your baby has had time to digest. 4. Review your latching technique. Babies can also begin to hiccup when they swallow too much air during feeding. Listen for rhythmic, regular sucking. If your baby is nursing too quickly and sucking in air, you will hear her gulping and swallowing loudly. If you are breastfeeding, make sure that your baby's lips are opened wide and that they form a tight seal around your entire areola, not just the nipple. Avoid hunching or leaning forward when you breastfeed, as this may make it difficult for your baby to latch. Aim your nipple at the top of your baby's mouth. Do this when your baby opens her mouth widely so that the nipple lays directly onto her tongue. If her mouth doesn't open wide naturally, encourage her by gently touching her lips and her mouth. Pull her towards you with pressure her back, not her head. If you are bottle feeding, tilt the bottle to a 45-degree angle, bottom up, so that your baby sucks in more formula than air. Consider using a bottle with collapsible bag inserts, as these are designed to reduce air swallowing. 5. Feed your baby before she gets too hungry. Plan feeding times at regular intervals, and learn to tell when your baby is hungry. A calm baby will eat more slowly than a hungry, upset baby. 6. Sit your baby upright in your lap while feeding. This will prevent air from settling in her stomach, expanding, and triggering hiccups. Hold your baby close so that his chest is close to yours. He should be looking straight ahead or up a little. You may find it easier to sit down while feeding in order to keep your baby on your lap. Sit straight up, leaning back a bit, so that you feel relaxed and comfortable. 7. Keep your baby sitting up for at least 20 minutes after a feeding so that any trapped air rises to the top of her stomach. This will relieve the pressure on her diaphragm, allowing her to burp and release the gas. 8. Be patient. If your baby begins to hiccup during a feeding session, stop feeding her and let her digest for 5 to 10 minutes. Keep her sitting upright and try to feed her again, slowly, once the hiccuping stops. Method 3. Using folk remedies. 1. Give your baby some sugar. This remedy has not been proven to stop hiccups, but there's no harm in giving it a try. Wet your finger or a pacifier and dip the tip into a sugar bowl. Let your baby suck on the sugar for a few minutes, and the hiccups may fade away. 2. Massage your baby's back. Place your baby on a flat surface on her belly, and allow her to move around a little bit. Gently massage her back for several minutes. This may help to loosen the sort of gas buildup that may be causing the hiccups. If your baby seems uncomfortable with the massage, stop immediately. 3. Be cautious when using folk hiccup cures that have not been medically verified. The following folk remedies have not been demonstrated to stop hiccups, and they can actually hurt your baby. Never try any of these methods. Scaring the hiccups away by making a loud noise or otherwise shocking your baby. Slapping your baby's back. Pressing your baby's eyeballs. Pulling your baby's tongue. Method 4. Diagnosing and treating acid reflux. 1. Watch your baby for vomiting and stomach pain. Frequent hiccup attacks may be a sign of gastroesophageal reflux disease, GERD, or acid reflux. This is a common condition in which babies painfully regurgitate the contents of their stomach into their esophagus. Look out for the following symptoms. Colicky behavior, frequent, intense crying fits. Stomach pain. Frequent, painful vomiting. Persistent coughing or wheezing. Hiccuping at night, unconnected to feeding. 2. Tell when your baby is in pain. Your baby may be experiencing chronic stomach pain if she cries often and inconsolably, long after she has been changed, fed, and cared for. She may begin to cry suddenly, for no apparent reason. 3. Contact your pediatrician. If you suspect that your baby suffers from acid reflux, take her to see your family pediatrician. A licensed physician will be able to help you understand what's going on with your baby, and may be able to advise treatment. In babies, GERD is usually caused by an immature digestive system. Most babies grow out of GERD by their first birthday. your doctor may advise you to wait it out. Be aware that older children may be at a greater risk for acid reflux if they experience the disease as an infant.